Assistant Special Agent in charge of the Austin District Office. Before I talk to you this afternoon about the drug task force that we're putting together, I'd like to provide you some of the trends that we're seeing nationally. In 2021, we had over 107,000 people die from drug poisoning overdoses. Of those, approximately 70% were related to opioids and fentanyl. Drug cartels are using social media and other platforms to flood our communities, like Kyle, with deadly fentanyl and fake pills. Last year alone, DEA seized over 20 million fake fentanyl pills. If you look at these photos here, you'll see exactly what we're talking about. One of these is counterfeit and one is real. If you can't tell the difference from where you're at, there's a reason for that. This is an actual authentic pill. This is a fake pill. Unfortunately, the fake pills look better in most cases than the actual pills themselves. And that's the problem. People can't tell the difference between a real pill and a fake pill. If you take a fake pill, you're gambling with your life. Remember, it only takes 2 milligrams, about the size of a few grains of salt, table salt, to kill the average adult. Please don't gamble with your life. Law enforcement cannot solve this problem alone. That's why the Drug Enforcement Administration is going to partner with the Texas National Guard, the Hays County Public Health Department, and local law enforcement agencies throughout Hays County to develop a overdose task force. The goal of the task force is to track down and arrest violent criminals peddling fake fentanyl or fake pills containing fentanyl. The other goal of the task force will be to educate the public and youth about the dangers of fentanyl. Today we want to get out a couple of messages to you. First of all, don't take prescription medications that are not prescribed to you by your doctor or dispensed by a pharmaceutical company. It's too dangerous. For the parents out there, please talk to your kids. Monitor their social media accounts, monitor their phone traffic. Make sure that your kids are not getting involved with this. You simply just don't know what they're dealing with. DEA has a program called One Pill Can Kill. When we talk about fentanyl and the small amounts of fentanyl that can kill a human, we just want to make sure everybody understands that one pill can kill.
The Hays County Sheriff's Department investigated 10 fentanyl-related overdose deaths. In Hays County, once again, let me emphasize, Hays County, outside the incorporated cities of Kyle, Butte, and San Marcos. This numbers outside does not include their numbers. We do not know exactly how many overdoses we've had in Hays County as far as overdoses, other than deaths. So, what I mean by that, most calls will come out as a medical call, and EMS or fire department may handle that call, and we may not, law enforcement may not be involved in that if it's some form of overdose. But deaths involved obviously will be. So what we've done, we're going to team up with the fire and EMS and into an overdose mapping tracking system. We started that already to help us track fentanyl. And that way we can help with investigative purposes. We can use this tracking system to help all investigators as our teams work together to put an end to this fentanyl crisis. I've also reached out to the Hays County Crime Stoppers office and asked them to increase the reward money to $1,000 for the arrest and indictment of drug dealers in Hayes County. So we're hoping that'll generate some activity. The last thing I like to talk about is what Special Agent just talked about. We want to reach out to every person we can in Hayes County and educate them. We started an education program a couple of weeks ago. When I mean reach out, I mean whether it's a school classroom, a school auditorium, a football locker room, the local Lions Club, homeowner association, anybody that allows us to come talk to them and tell them about the dangers of this fentanyl, this drug, and how social media is involved with it. So if you do want to do that, which we encourage anybody in this county to call, we're ready to do it. We started 2 weeks ago. And like I said, we'll go right into the Girl Scouts meeting, if we can call it. And we want to talk to all levels, about their age. We want to talk to them about the deadly effects of fentanyl and how it's poisoning our kids. So if you want to do that, the phone number to reach us at the Sheriff's Department is 512-393-7896. And we'll have someone to make arrangements to come talk to your group, whatever group it is. It's time that we get together. We have to pull together as a team here. Law enforcement is doing it. We've got to get our community, we've got to get our youth to work with us. We've got to put a stop to this. If not, the last thing we want is for officers responding to another fentanyl overdose death. So thank you.
Well, yeah, we'll take some questions.
If we can elaborate, in terms of social media, you're saying the drug cartels are using that to attract our youth. How so? I mean, are these ads or what does this look like?
So primarily they are using, of course, chat groups. They'll form Discord groups. And they'll also do some advertising through their own channels, and they'll push the agenda out that way. When they're using social media, of course, they're going to show the product, advertise prices, and then make arrangements for when and where to meet.
In terms of arrests, we see that we have 2. Obviously there's more suspects. Are we thinking of a ring here, or are we dealing with several suspects that you could possibly talk about, Chief?
So without going into specifics about the investigation too much, I'll tell you that we're certainly looking at all leads that will tie back to the illegal trade here in Hayes County. Do we think there will be more arrests? Absolutely. And that's because I have the confidence in our men and women that are working these cases. And after sitting in a briefing and getting an update on their progress, I have no doubt that they will continue their good work and they will bring more people to justice for bringing this deadly substance to our community.
And Chief, I apologize if you mentioned this, but do we know if the 2 that were arrested were linked directly to these students that were affected, or is that unconfirmed?
I won't be able to divulge what we know about their involvement in the entire process. However, I shared with you the charges that they had. Obviously, one of those individuals, the adult, had nearly 400 pills in his possession. This is a target of our investigation, is to find these pills because of the deaths and the overdoses that we've had. And should we be able to release more information about their direct involvement, we'll do so if we can.
Are you able to say the types of drugs that these students were taking? Was it Percocet or was it others?
In most cases, it's been a blue pill, and I'll speak specifically to the cases here in Cobb. It's typically a light blue pill. It's stamped with M30 on it. It is intended to look like another prescription drug that one may legally get at a doctor. However, the contents of that pill is not what you think. It's not, because they're not made in a lab. They're not made in a pharmacy. They're not prescribed by a doctor. These are street-made drugs, and that's why they're so dangerous. But the ones that we found mostly here in Cobb are the light blue pill with the M30 stamped on them. But I need to encourage you as parents. You need to have a conversation with your children about the possibility that these drugs are going to change shape, color, size. We're already seeing that across the country. We've heard some conversations about rainbow varieties and versions, and the DEA has done a really good job at trying to share that information and what they see nationwide. So don't let me mislead you and let you look just for the baby blue powder pill with M30 on it, because tomorrow it may be yellow or pink or green or any other color. So you need to educate your kids. So the parents, please talk to your children about the dangers of taking any medication from anyone else. I don't care if they say it's a prescription medication that they got themselves from their doctor, or if they say it's some type of candy, or anything that's going to help them relax, or anything like that. You need to have that hard conversation with them and tell them that they can all be dangerous and not take any. I'll briefly add one point that I made at a previous press conference. These pills, they'll break them up into small pieces, and they'll share those pieces, or they'll take a small piece at a time because they think that is safe. That is absolutely not true. Again, these things are street made. They're not made in a lab. They're not even. They're not a properly constructed medication that you would take. So even one piece of a pill could be deadly. So it's an important message to get out. Yes, sir.
Chief, you're saying that they're being street made. Do we know where they're coming from? Or are they made locally in Hayes County?
So our indication so far in the investigation is that it is coming from the greater Austin area, and then the Austin intelligence shows that many of those are coming across our border and are being made outside of our country.
DEA can provide further to drug cartels that we.
So, what we can provide to you right now is that many of these pills are being produced by the Sinaloa and CJNG drug cartels. The fentanyl is coming into Mexico, they're being produced in Mexico, and then they're coming across our border.
One more question.
Can we just talk about the greater appeal? Because we have out, I mean, we're from Austin, San Antonio, around here, and I know we're focused on Hayes and Kyle, but if these can end up, you know, kind of along our area, because we're trying to talk about a broadened approach here. You know, I know it's unfortunately happening here, but can you at least elaborate and talk about the other areas that this could go into, or it's already at?
A little bit about, okay, sure.
Just briefly from our perspective, and I certainly need to yield to DEA, from our perspective, this wasn't particularly a problem here in Kyle. I'm not saying it wasn't present, but it wasn't present like it is today. So the increased availability here in our community is why we're all standing here today, and the injuries and deaths that it's caused to our community. So that's what's happening here. This has been a nationwide problem for several years now, and DEA can address that. But what we're here talking about in Kyle is the fact that that drug has made it into our community, and it's harming our citizens, and specifically our youth.
Yeah, I just really reiterate what the chief said. This cuts across all races, socioeconomic levels. It's non-specific. It doesn't matter who you are, what you're doing, where you came from. Once it makes it into your community, it's there. And we, quite frankly, we're going to have to dig it out. Again, law enforcement can't do this by ourselves. We've got to have the community's help. We can sit up here and tell you about arrests and seizures all day long. But the simple fact of the matter is, if the parents will get involved and work with us, we can address this at a more finite level, down with the family level, and that's where we need to be.
Thank you so much.
Thanks for being with us here on KXAN Live. Will Dupree coming to you from the KXAN Live studio, where we just heard from a member of the Drug Enforcement Agency, as well as the police chief from Kyle and the Hayes County Sheriff, discussing the increase in deaths linked to fentanyl-laced drugs in that area. Hayes CISD announced yesterday that a fourth student's death is tied to fentanyl. That's on top of the 3 others that they had shared about previously, and talking about raising awareness and asking for families' involvement. You heard that there from the other law enforcement officials, asking for parents to be mindful and talk to their children about this and monitor some of their social media accounts, because according to the law enforcement there, that's how this drug is making its way around in some of these younger populations. So I wanted to pass that along. If you would like to read more about our reporting on the deaths that have happened, unfortunately, in Hayes CISD, you can find it right now on KXAN.com and on the KXAN News mobile app. Thank you for sticking with us here today. We'll see you back here at another time. Hope you all stay safe and healthy out there, and take care.